Hi, I'm Kenny Anderson, Director of Multicultural Affairs for the City of Huntsville, and welcome to Impact. Each week we bring you information about exciting things that are happening right here in this great community, and today will be no different. You know, from time to time I learn about interesting programs that are either startup programs or programs that are well-established programs that are making an impact in a wide variety of people's lives right here in the City of Huntsville. And today I want to introduce you to someone who is doing just that. She's Chandra Crutcher, and she's Huntsville's first certified geriatric care manager and Alabama's first registered guardian. And we're going to ask her all about what that means, starting with the American Senior Assistance Programs Incorporated, otherwise known as ASAP, Inc. Welcome to our broadcast.
Thank you for having me.
It's good to have you here today. And
So
it's
good to be here.
Yeah, it's good to have you because every time people come on and they've got new ideas and new initiatives, I just see it as one more opportunity to demonstrate what a great city we live in, a compassionate, caring community that really seeks to make a difference in people's lives. So thank you for being here with us today. Tell us a little bit about what this program is.
For sure. I'd like to start by just saying the 65 and older demographic is the fastest growing demographic in our country. And so we saw a need back almost 12 years ago to really join the older adults in our community on their journey in navigating elder care resources. So American Senior Assistance Programs, ASAP for short, is an interdisciplinary geriatric care management program. We have social workers, nurses that go out and help seniors figure out how to stay in the least restrictive environment possible in a way that best preserves their assets.
Yeah, you know, you hear that term a lot, and I'm saying you, I mean, I'm a mental health professional, so I've heard the term least restrictive environment a lot, but other people may not.
Yes.
Tell us what that concept means and why that is so valuable to people who may be elderly or perhaps people who have disabilities.
Kenny, it all comes down to quality of life. And quality of life has to be defined by the individual. And some of our older adults have very fortunately planned well for aging, but others not as much so. And so least restrictive environment for many, they dream of that being their home. They want to age in their home, they want to live in their homes and spend their last days at home. But when care comes into play and finances are an issue, sometimes that least restrictive environment may not be the home environment. So it brings into the dialogue assisted living, specialty care assisted living facilities, skilled nursing facilities, or what others may know as nursing homes. We are so blessed in Huntsville to have so many different options when it comes to getting the care that an elderly person may need. And so our company comes in place and we do a comprehensive assessment to help determine where that care can best be given.
Yeah, so that's an important dynamic, I think, right there. The idea that you do have this sort of a plate full of options and different choices that people have to make, and navigating those choices is not always an easy thing. I mean, all of us are getting older. All of us are essentially going to be at a point in life where we're probably going to need more care than we did when we were much younger than that. But we don't always plan well for that. In the same way that we know life insurance is important, but when we're young and our whole life is in front of us, we don't necessarily make that kind of a commitment. So it's important that you have an initiative that lays these options out before people and gives them a chance to kind of choose through them. And I'm just interested in knowing what that experience is like for the people that you work with.
Oh, wow. It is so enriching. You know, the word I get back most often from our families, from the elderly clients, from the professionals that we engage, is that it's individualized value. I think value is relative. And if you were in a hospital and being told that you're going to need a different level of care than you had coming in, many people, like I heard the pastor say on one of your other shows, that crises doesn't call and make an appointment, or tragedy doesn't make an appointment, it just shows up. Sometimes those issues that affect older people, they catch them off guard. And so going in and bringing value and meeting that senior where they are, I think that's one of the greatest things that we can offer. And so we try to do that in unique and creative ways because people don't want to talk about the bad stuff. We don't engage death and dying as readily as we should. And so we partner with a lot of other nonprofit organizations to proactively educate the older adults in our community. And some of our younger older adults, that baby boomer, that 60 to 65-year-old, before it's need-based, because crises, if you deal with issues pre-crises, it's going to cost you less. It's going to cost you less financially, emotionally, and oftentimes even physically.
Yeah. Well, you mentioned a target population, and that automatically suggests something about what you're saying. That's probably the not so obvious piece, even though it's one of the evident ones when you really think about it. And that's that these people that you work with are usually connected to family members.
Yes.
And sometimes it's the family member that has no idea how they're going to take care of mom or dad or grandma or grandpa. And they don't want to throw them away. They want to make sure that they have a graceful experience in their waning years as well. So talk about what this kind of a process means to family members and why it's something that can potentially provide them with the things that they need.
We partner with our families in two ways. One is educational, the educational piece of this is what you can expect with mom. That is very valuable for that out of state or out of town adult child, just to know with this disease process, this is what I can look forward to. And the other, just those practical steps. Many of our adult children are working. And so they may want to go to that doctor's appointment with mom or dad and just not be able to. And so we send our social workers, we send our nurses or our in-home care aides to partner with that physician and then to communicate back with that adult child to make sure that implementation of the strategies that the doctor is putting in place is carried out. Because a lot of times, even with me, I can remember once I went to the doctor and broke my ankle. And all I heard was like that Charlie Brown teacher, womp, 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 womp. It just was not processing. Everything past your ankle is broken was gone. Well, you add in mental health issues, oftentimes cognitive impairments, and just being human and it being your reality. And that older adult may not process all that the physician is saying. And so the follow through isn't what it should be. And so we send advocates in on those practical things, the doctor's appointments, the hospitalizations, the engagement of home health, to do the tours of the long-term care facilities, and then report back to the adult children in a way that they can help their parent or their loved one make an informed decision. So education and then practical engagement. Those are the two areas that we find most beneficial to the adult children.
Yeah, successful realtors always say location, location, location is what makes it happen.
Yes.
When it comes to social services and needs that we have, I think we could say support, support, support.
Yes.
There's so many things out there that people have accessible to them, but they don't always know what it means. They don't know how they qualify. And so how does one qualify for your program and your services?
We have our for-profit side where long-term care insurance and private pay individuals come in and utilize our services. We also have our nonprofit arm because we saw the need was just so great. I was in a meeting just on Friday where the governor spoke about health literacy. And health literacy in Alabama is just alarming. When you think about just regular literacy rates, they're some of the highest in our country. And so when you have individuals that are trying to process and navigate through this healthcare maze as an older adult, it can be quite alarming. And so our nonprofit arm allows us to really hit some of the most underserved areas with information that they wouldn't typically get. So we have our private pay clients who call us, and for a retainer, we go in and assess and join them on their journey. And when I say private pay, that may be private insurance. And then we have our non-for-profit arm where we really try to give back to the community.
Okay, so I introduced you as Huntsville's first certified geriatric care manager and Alabama's first registered guardian. What does that mean?
When we started 12 years ago, I was working as a licensed nursing home assisted living administrator. And just really saw a need. The individuals, when they come into your facility, that's one product, Kenny. And I could educate them really well on that one product. But I had a little lady come in one day and I wanted to send her to the facility up the street. But that wasn't what I was paid to do. I was paid to educate them on my product. And I realized the important need to have someone to join you and to put you at the center and really match services with your individual needs. And so a geriatric care manager does just that. They go out, geriatric care management has been around for some 40 odd years. Usually they specialize in a particular population group. Our population is that older or disabled adult. We get into mental health issues quite a bit. But the geriatric care management side, usually social workers, nurses, that go one-on-one with that individual and figure out what are those services, what are those resources that are, again, going to keep them in the least restrictive environment possible in a way that best preserves their assets and gives them the highest quality of life as defined by them.
Well, it's also said that death and taxes are pretty certain, but on the way to both of those processes comes the aging process.
Yes.
And so all of us are on that journey in some form or fashion. All of us are going to arrive there at some point, and all of us would do well to inform ourselves about the available resources out there. I'm always saying that Huntsville is one of the most resourceful communities on the planet. Anything that you want is here, and if it's not here, there are people who are willing to stand by your side and help you create it.
Yes.
And so this is really a great community as far as those things go. I know you've got some other programs that you're working with as well, and in the last 3 minutes that we have, maybe you can share some of those things.
Most definitely. We have our monthly Caring Talks program. We just found that there's some topics that families and individuals just don't engage readily. Hospice, home health, the financial aspects that come into aging. And our Caring Talk for this month, which is held the last Wednesday of every month, this one is to be held on February the 24th. They're always at First Baptist on Governors. And the topic, for example, this month is cardiovascular disease. Dr. Raynon Andrews will be there sharing, and so we just want to make everyone aware of that. And advocacy is a big piece. We partner quite often with the Alzheimer's Association, the Mid-South chapter. Their office is right here in Huntsville. Invaluable information for those with diagnoses of Alzheimer's or other dementias. And we're going down to Montgomery on Tuesday, February 23rd, just to make sure our legislators know what families are dealing with related to Alzheimer's. And that's on Tuesday, February 23rd. And then, Kenny, lastly, I just wanted to mention one of the things that our community is realizing is that education is so key to aging well. And so I've been a part of the Successful Aging Initiative out at Alabama A&M for the last 10 years. And we are so blessed to be opening Huntsville's first, and I think it's only one of 2 HBCUs in the nation that have lifelong learning institutes. So the Virginia Caples Lifelong Learning Institute is being endowed on March 19th of this year. And so just really excited about sharing what is all, it's been happening for, I think, 13 years they've been doing it. We've been involved for about 10, but they have done some great things in our community in educating that older population, and now we're going to be able to formally do that through the Lifelong Learning Institute. So if anybody would like to learn more information, you can visit our site at letstalkasap.com.
All right, and so as people are listening and they're taking information down, there are lots of resources out there. There are lots of opportunities for people to learn things. There are lots of challenges that people are facing, but there are answers to those challenges if people would just simply make that phone call and find out about that.
As proactive as possible.
That's a great word. I mean, people need to be forward thinking in their processes. Again, at whatever age they are, you know, we have a whole generation of people that are listening to the show, watching the show today, and you got folk that are probably much younger than the older people, but they need to be thinking about these kinds of things. Being proactive helps you be better prepared when something happens, and none of us ever know when something might happen, and it's important to be engaged in that process. We're going to look forward to ASAP being on the scene for a while. I know that you probably are developing other programs and things as we go, and this is just one more way that people can learn more about what's happening with your organization and community.
Yes, we want to keep people informed. We believe that the goal is finishing well, and finishing well means doing today well, doing tomorrow well, because crisis can meet us all, as you said, at any time. And so just to encourage that proactive dialogue, you'll see that's a lot of our theme. So we just encourage individuals. We have a free online newsletter and a free e-library that addresses many of the long-term care topics, and that's at letstalkasap.com as well. So we just encourage your listeners and your watchers, your studio, not studio, we have a studio audience, but the people that are out watching to tune in to us on letstalkasap.com.
All right, letstalkasap.com.
Yes.
All right, Chandra Crutcher, Huntsville's first certified geriatric care manager and Alabama's first registered guardian with American Senior Assistance Program Incorporated. Thank you for being here with us today.
Thank you for having me. Thank you.
All right, we hope that you enjoyed all that great information, took lots of notes. We, of course, will post some things on the screen for you to be able to connect with this very valuable and important organization that I know will be of some value to you. We have an aging population in the United States. People are living longer, and consequently, there are many more challenges that we have to face than we ever have before, and they can be faced with grace and dignity and information. We hope that you'll also like our Facebook page at Kenny Anderson, or I should say Impact with Kenny Anderson, and you can follow along with all of our postings of previous shows as well as upcoming shows and photos of what's happening right here in the studio. For Impact, I'm Kenny Anderson. I hope that you have a great rest of the day, and we'll talk again soon.